We've done probably 12 to 15,000 procedures with this XprESS device. There's more than 30 clinical studies that kind of show that these balloon procedures are really helping patients and really improving the quality of life. My background is I've spent more than 20 years in the research and development field, in the medical field, working at companies at Boston Scientific and TerraMed, just working in research and development my whole career. A couple of coworkers came and approached me with an idea to do balloon dilation of the sinuses, and it sounded very interesting to me. Our approach was ENT physicians were very much trained on rigid instruments similar to this, and they use kind of tactile feel to locate different sinus passageways. And the idea came out of, why don't we just have a more rigid tool similar to an ostium seeker, and then just have a balloon that can slide into that same position. Additionally, have the ability to transmit light through our devices, so not only does the rigid device have tactile feel, we've got the ability to illuminate, as you can see, which when this particular device is for the frontal sinus, and when placed in the frontal sinus, it can actually transilluminate through the forehead to identify that you're in that correct location. Our main product here is this XprESS device. This device has a 2-millimeter ball tip and a balloon also, and the balloon just slides into position. And once it's into position, it can be dilated and placed in any location and just dilate the balloon as desired. And all this is being done under endoscopic visualization within the sinus, so the physician actually has a camera inside the nose that he's watching where he's placing the device, and then he's dilating those spaces with this particular device. This device can be used to treat both recurrent and chronic sinusitis. And a lot of these patients are currently being treated in an office situation now. It's similar to angioplasty in the heart. It's opening up transitional spaces. It is the reason people are getting disease and these chronic infections is because the spaces are too tight, and we're actually remodeling these spaces with the balloon. So the balloon, it's kind of thin, bony, mucosa-covered structures that end up being just kind of dilated open, and then that allows the mucus and it allows the sinus to clear themselves because they're fully aerated and they can drain properly. One of the real advantages that this device provides also is that it's got the ability to treat frontal sinuses, maxillary sinus, and sphenoid sinuses. And I'll just real simply show you that the metal is actually malleable, which means it's just shapeable. So I can just take and straighten this device out. And I'm just going to shape this for a maxillary. So if the patient needed a maxillary sinus treated, we just take and bend this around this here bend. And really, now it's set up to do a maxillary. And this is a good starting bend, and it can be slightly adjusted as needed. But then the balloon can kind of completely advance to the tip, and again we can kind of do that dilation. But I think that's one of the real advantages this device has is the ability to really do a lot of different things. It can treat the frontals, the sphenoids, the maxillary. It's also got irrigation and suction capabilities. So for office procedures, it can really be a easy to use device. The doctors are very happy with the XprESS because of its simplicity and ability to treat a lot of different sinuses with the same tool. It's quick and virtually pain-free. This is just a case example, but I was in San Antonio one time, and a patient came in that wanted to go to the movies with her grandkids at 4 o'clock, and she walked in at 1:30, and we were able to do a CT scan, identify that she had maxillary sinus disease, treat the disease with the XprESS with dilation, and the patient left at 3:30 and was still able to make the movies with her grandkids. Yeah, it's just been a great feeling to just be able to help people feel better. This is a very debilitating, sinus disease can really be a debilitating condition for people that have this recurrent sinusitis and chronic sinusitis, and we can help them with a simple balloon procedure in the office. It's wonderful.